Welcome to Unstitching ADHD Urban Ed Talks, where we explore how ADHD, often referred to as Attention Deficit Hyperactivity Disorder, shows up in classrooms, homes, and communities, and how collaboration can make every student, and I repeat, every student, thrive. I'm your host, Dr. Stanley Akio. Today's episode is going to examine how schools, families, and medical teams can better collaborate to support neurodivergent students, especially those with ADHD. My guest today is Dr. Amy St. Croix, who brings over 20 years of leadership in special education, deep expertise in system collaboration, and a lived experience as both a professional and a parent navigating ADHD across different presentations. Dr. St. Croix, thank you so much for joining us and welcome to the show.
Thank you so much for having me.
My first question for you is, you have spoken openly about your personal connection to ADHD, right?
Yep.
Both lived experience and parenting two children with different presentations.
Mhm.
How has that shaped the way you approach your profession in education and collaboration?
I think that the older I get and the more experience that I have in the field, I almost wish that I had this back when my kids were a bit younger. I have one child who will be 21 in just a couple of weeks, and I have another one who's going to be 19. So I've gone through that process with them, the process in school, the process in classrooms, dealing with growing up, the IEP process. And I really wish that I would have had the knowledge of neurodiversity and what that looks like real life in the classrooms, in a social setting, in sports, even theater and music, and all of those things that our children just do as part of going to school. I wish I would have had that knowledge when my children were younger. I've lived it, right? My oldest is a boy and my youngest is a girl. So their characteristics present very differently. That's typical in ADHD. Boys present differently than girls. It's tricky for parents to be able to identify what is behavior and what is ADHD. It is difficult for teachers to be able to identify what is lack of effort and what is neurodiversity and what is the ADHD brain. It can be a tumultuous time for those that are in the lives of children with ADHD. And then, of course, I have it myself. So, with that, I think that when I was a child, I was not diagnosed. My parents had no idea. It just is what it is, right? It was my personality. And then as I got older, I started to realize, not so much even in high school, but in college, I started to realize I had to I had to pick a career that was not gonna be mundane or that wasn't gonna be repetitive or that, that kind of a thing. So, I went into education because I wouldn't be sitting in an office every day. I knew that it wasn't going to be, immersed, in an accounting ledger or anything like that. And I have to be honest, I taught maybe 5 months and I said, "This is not going to happen for the rest of my life." Um, I was a high school English teacher, and I was teaching the exact same thing 6 periods a day, and I just couldn't do it. And so I did stay in teaching for several years after that, because I got my administration degree. But administration was really where I could get up and walk around. I didn't My days were very, very different. No day in the world of a school administrator is the same. No hour in the world of a school administrator is the same. And I worked with different people every day. I did different things every day. I was always on the go. It was super fast paced. And it really just met those needs that I had as a neurodiverse individual. And then, of course, as I progressed through my career, I was able to identify my own challenges and the strategies that I needed to be able to implement. And then, of course, we worked through those as a parent for my own kids. There's a personal journey there for sure.
See, that tends to explain how this perspective grounds your work in both empathy and practicality. It's powerful to hear how those worlds connect. Being an high school teacher, having it, that's just, I think, a wonderful experience that kids will benefit from. And I'm so excited you are in this area supporting kids who might not have the support they need.
I'll often be
Yeah, go on.
working with parents, and parents
Mhm,
are talking to me about what I refer to as behaviors. I love that I can look at them and say,
mhm,
that's okay. That's
mhm,
the ADHD. Because
mhm,
it's almost a relief to parents when you're able to identify that, right? There's a reason my child is unable to follow two-step directions. It's not because they don't want to, it's not because they're defiant. Um, there's a reason behind that. And I think that having kids of my own who have it, and then, of course, myself and my experience, I think it's really important when I can look across the table from a mom or dad and say, "That's okay. That's the ADHD. We got strategies for that. Like, that's okay."
I've been in situations where people say, I have a whole class full of boys with ADHD. My girls are doing okay. I don't have any problem with them. It's just the boys. And now there is a growing awareness that ADHD can look very different in girls compared to boys. What do schools and parents often miss about these differences?
So, boys tend to exhibit what I always talk about is textbook. It's what we read about, right? It's very externalized. They're typically high energy, potentially disruptive. They're identified much earlier than girls are. When we think about those boys that are, a ruckus, right? They bounce off the walls. They're super high energy. That's kind of how we think about ADHD, right? Boys, it's much more externalized. In girls, it's often very, very different. It's internalized. It's often masked. And we're not even able to identify it until many, many, many years beyond when we would identify it in a male child. So, for example, a girl may be an extreme perfectionist. We might see what I refer to as executive functioning skills, but where a parent might refer to, a girl who keeps a messy room or is unable to write in their planner on a regular basis for their homework. We also see a lot of social, emotional challenges with girls with ADHD, as where boys with ADHD still fall in that realm of being boys, right? So, it's kind of like that old cliche aren't getting along, they just pop each other and then they move on, right? But when girls don't get along, it lasts for years, is very difficult in the world of ADHD. So often, what we'll find is with girls, you might see things that moms and dads just don't pick up on, like a little girl who might not be getting invited to play dates, or they may not be invited to birthday parties like their peers, or those kinds of activities that are within friend groups, or you might change friend groups all the time. They're bouncing from friend group to friend group. It's a really, really difficult time for girls. And it can be masked. Moms and dads don't even realize that it's happening because it's not always hyperactivity. We don't always see that when we look at girls with ADHD because it's internalized. So there's definitely a difference between boys and girls diagnosed with ADHD.
Thank you so much for that important distinction. So often girls fly under the radar because their symptoms don't match the classic, like you said, hyperactivity picture, right?
Yeah.
From your experience, What do effective partnership between educators, healthcare providers actually look like in practice?
Yeah. We really need to acknowledge that teachers are experts in the classroom and doctors are experts as clinicians. Very often, I don't see that. What I see is a doctor or a medical professional diagnosing and then, you know, really giving some recommendations in the world of medicine, right? And then schools just kind of say, well, that doesn't work for us here. And it gets put aside. And what we really, really have been working on is bridging that gap. So, one of the programs that I partner with is with a couple of local pediatricians here where I live, myself and a behavioral therapist. And we see the students, we see our patients with a holistic approach. So, what would happen is, our medical team sees our patients in regards to potentially everyday illnesses, but also behaviors, struggles in school, those types of things. And then what happens is those families will come to us as a holistic group. So we bridge that gap. So what's happening is doctors, the medical field, they're still assessing our kids. They're still providing recommendations for our students. Obviously, they're still the ones that would administer medications if needed or that a parent was interested in. But then what happens is they see me and our behavior therapist, and we're able to bridge that gap between education and medicine. So what happens is when we go into schools or we work with schools, we're able to talk to them about things like, a doctor might recommend something like supporting executive functioning skills. Well, what that means to a school is we're going to chunk assignments. We might potentially offer one step directions. We might offer directions both verbally and visually to a student. So it's bridging that gap between the medical world of diagnosis and the education world of reality, right? That day to day living of what's really happening. And it's bringing those two together to understand that each is an expert in their field, but these fields are not separate in any means. And what's happening is kids are suffering because we are making these careers, these fields separate. And there's a bridge that needs to happen between the two of them to bring them together in order to have, our doctors and our pediatricians and our developmental peds share info on medication and sharing information on assessments and our when we're talking ADHD, we're talking our brain, right? So share that information with what the teacher observes in the classroom. What changes are happening in the classroom? What supports are able to be provided in the classroom that will satisfy what our doctors are seeing on the medical side?
Well, I was really excited when you are accepted to appear in this episode because the truth is that's the disconnect. When most parents hear about medical, the first thought is medication. The second is my kid must have something really terrible that we should be seeing our doctor about. Having you bridge that gap, this could be a model that tends to create clarity, to ease that fear of what's going to happen, the unknown, right? So that awareness, that education, I think is a powerful work you guys are doing. And hopefully, when we get to the end, I would want to hear more about that and share information to help our listeners that might want to reach out to you for more information. Now, let's talk about clinical recommendations. Most parents, teachers struggle with trying to break down clinical recommendations. and how to turn that into action in the classroom. What are some ways to make that translation process more practical?
Well, I think in my world, it's really for
Mm,
development, right? No. I think that we could talk for hours about how we potentially could do that, how the system is really failing our kids. Colleges, for example. When we
mm,
go to school to be teachers, we have very little education on
mhm,
neurodiversity, if any,
mhm,
and
mhm,
how the brain works. It's not a deficit by any means. It just works differently. I work with multiple medical practices and we bring in neurodiverse training and framework. They're experts in their field. But when I bring up things like IEPs, there's just no knowledge there. And it's not by any fault of their own. It's a system, right? It's how we're training our professionals. And it's also how society is evolving. The kids that we're seeing in our classrooms today are not the same kids that we saw 10 years ago or even just 5 years ago. I talk with both doctors and with educators that the fact that our developmental milestones in education don't exist anymore. So, what used to be what we would say on grade level, that doesn't exist anymore. So, what is on a first grade level, our first graders aren't there. It's just not where we are at this point. So, we're still trying to measure kids on a scale that no longer exists. And regardless if you wanna blame that on COVID or you wanna take a look at how our society is today, it doesn't matter. But if we're taking a look at COVID kids, we're like 20 what, 24, 26 years now before we're gonna have accurate data again for these benchmarks because we gotta get kiddos through, right, that essentially are COVID kids, and then we have to run through a whole entire cohort of 13 years of kids beyond COVID in order to be able to have some comparable. So, we're just sitting in a really unique space right now that the kids in our classrooms and the kids that are coming into our practices are not kids that we have potentially seen before. So when our doctors are giving medical recommendations, what does that look like in a school? And we have to be able to take those recommendations and turn them into practical use in a classroom. We have to remember what that looks like, right? Some of rooms across America are looking at 25 and 30 kids in a classroom. So if you have a child that needs a modification, accommodation of a test read or directions read, what does that look like in a classroom of 30 other students? And how many of those other students also need that? So it's really taking those medical recommendations and moving away from paper, moving away from textbooks, and bringing it into practice because that's what's happening in a school, right? For everything that we read in a textbook to be perfect in a school, but it's just not. That's just what our teachers and our administrators are going through every day. I think that that's where my expertise really comes in when I these doctors. I've been inside of a school as an administrator, right? I've run a master schedule. I know what that looks like. I've developed them for years. I've done curriculum and instruction. So I'm able to have those tough conversations with doctors and say, I love your idea, but that's not going to work in a master schedule. So it's finding the practical use of what doctors are seeing on paper and how we bridge that gap.
Interesting. There's something I always talk about good teaching practice too. You know that popular saying, crisscross applesauce?
Oh,
And till today, people still believe in crisscross applesauce. And if that's the way you're thinking, like I always say, then we have a big challenge, right? So you have emphasized the importance of shared understanding between educators and medical professionals. And in your case, you are able to break it down when you are the bridge between these true professionals. What might true cross training, look like in your own opinion, and how could it change outcomes?
Yeah, we do a lot of cross training. So, one of the examples that I can give for you is in schools, we have our own strategies that we utilize in order to communicate with neurodiverse students. And I don't just mean verbally communicate. Some of those strategies revolve around regulation. And very often in our classrooms, neurodiverse students are dysregulated. We have those strategies in place and they're pretty familiar. If you walked to pretty much any elementary teacher and said, "Do you use the first then language?" They're gonna have an idea what you talk what if you say to a medical professional, "Is your practice using the first then language?" There's no knowledge of that concept. So that's a cross training that we do that is so, the strategies are so simplistic. But if a child who's neurodiverse in a school is used to hearing the words, first we're going to wash our hands, then we're going to go to lunch. If we can use those same strategies in our medical practices, then that allows one, that consistency that that neurodiverse brain thrives on, right? That routine. But our kids are able to understand that. So we say to them, you know, first we're going to get your height and weight, then we're going to go to the exam room. It's the same concept. And it helps as far as that routine, knowing what's to come, and that we know dysregulates neurodiverse children, right? So by changing that language and allowing us to cross train our medical professionals with the strategies that are being utilized in school, we can help with that dysregulation during office visits. And then, of course, a simplistic example, right? Like that's working with kids on a daily basis within the practices. And then we move into areas like IEP or I just had a doctor call me a couple of weeks ago, and they had said that a school district was asking the parent to have the doctor write a slip that the child should be out of school for several weeks for emotional concerns. And the pediatrician called me and she said, "What do you think about this?" And I said, "What do you think about this? Would you have written that script? Would you have written that note if it hadn't been asked for?" And she's like, "Absolutely not." And I said, "Then don't write it." Asking doctors to write kids out of school so that in the education field, we don't have to bridge that gap either. It's on both sides. We have to find that bridge. So, you know, that cross training, that's essential. And we're starting that. Schools, I think, they might be a little bit ahead of the game in the sense that they've been living in the practical world for a while. But I feel like the medical field is a little bit ahead of the game because they have that research based knowledge. We just got to bring that together now.
Great examples you just gave here. Most times when I present trainings, I always say, first and then just use the old fashioned grandma's law. You finish your chore, you go play. It's as simple as that. When we use languages that people can understand, like the way, translated it into the medical office, then people understand it's now consistent. The kids now understand what we're talking about and we are bridging that gap. I love that so much. And you mentioned something about the IEP, right? So,
Yeah.
what would be your guidance to parents that feel overwhelmed, right? Most times with navigating the 504 and IEP plans for
Yeah.
children with ADHD?
That's what we do, right? That's our
Mhm,
whole premise of why we exist. But
mhm,
what I say to parents and what I say doctors and when I'm in schools is, but specifically to parents, you have to ask questions. Such an overwhelming world. There's so many regulations, both at the state level
mhm.
and the federal level, and schools are truly doing their very, very best. They're trying.
Mhm.
But you know
Mhm.
what? Things get missed because that's real life. And
Mhm.
sometimes kids are not succeeding. And schools don't always have all the answers. So if you're a
Mhm.
mom or a dad and you have questions, you need to ask. And I don't mean
Yeah.
just ask school. Ask your
Mhm.
pediatricians, ask your
Mhm.
ABA therapists, ask your special education consultants, ask
Mhm.
questions because
Mhm.
so often schools are in a routine, right? There's 183 days, and we've got a program for September and moving in October, holidays in November, and we just move. And then we reach that annual review process in the spring. And often parents think they can only bring up questions or concerns in the spring when their child goes to annual review. And that's just not true. If you have a question, it's February, you ask. If you want to go back to committee in November, call a program review. Don't wait. I always say it's the best time to call an educational consultant is not in the middle of a crisis. If you're a mom or a dad struggling with the IEP process, you need to ask questions now. And so often, what happens is there's a cycle to this, right? September and October are honeymoon periods. Not a lot of action happens, everything's going well. November, things start to fall, the wheels start to fall off the cart. And then nobody has any time in December. We come back in January and we want to kind of try things for a little bit. In January and February are not real great. We're starting to see the wheels fall off again. By March, there's no car, let alone wheels, and everybody's frantic in March and April. And everybody's jumping on board. We got to move, we got to move, we got to move. We're headed towards the end of the school year. Then summer comes. And it's the demands at home on summer vacation are different than the demands at school. Not because school is better than home and not because home is better than school. It's just the reality of the environment. So very often we think that kids are doing fine. Well, sure they are. It's July. And then what happens is we start that cycle again in September. So if you're a parent and you have a question, or if you're a parent and you have a concern, the time is now. Don't wait. Call a program review, call a doctor, call a teacher, call an educational firm, get the questions answered now.
Empowering advice, I would say. It really refrains, right?
Yep.
Parents as partners rather than passengers.
Yes.
So get involved. That's really empowering.
Yep.
With your experience and wealth of knowledge, especially around systems, if you could make one systemic change to improve ADHD support in schools, what would it be and why?
I think that if I could change one thing in schools, it would be that ADHD kids are not naughty. So very often, I believe that stigma is with our ADHD kids. Regardless if they're boys or girls, I tend to see it more with boys than I do with girls, but very often the impulsivity that comes with ADHD ends up becoming a label of a naughty child, regardless if they're just needing to be spoken to on a regular basis to refocus, or if it's as extreme as suspensions in school. Often I see that there is a connection between the diagnosis of ADHD and the label of a behavioral student. And when we talk about the grand scheme of things, I will sit in manifestation determination hearings and superintendent hearings, and I'll hear people say, there's absolutely no connection to the disability and the behavior because I saw them be able to pass that other student in the hallway just yesterday. They didn't punch them. So it wasn't, they're capable of doing it. And that could not be further from the truth if you understand the brain of a neurodiverse child. And if I could change anything, it would be the understanding of the behaviors of a neurodiverse individual and where they're coming from, so that people in a school, regardless of what their role is, understand why behaviors are happening.
That's a very hopeful vision and one that really ties everything we have discussed together. Now, before we round up this conversation, you mentioned something that those who don't understand might be wondering, what does that mean? You said something about manifestation meetings.
Yeah. A manifestation determination hearing is when you have a student who has an IEP and they have been suspended from school multiple times. Typically, we see them, they have to happen by the 10th day of suspension, in school suspension or out of school suspension. But very often we'll do them at the 7-day mark just in case there's an incident after the manifest. But they happen after multiple days of suspension or a pattern of suspensions. And we go to that hearing, and what happens is the whole entire situation is presented, and then it is determined if the child's behavior or the student's behavior is a direct result of their disability, their classification, their disability, but that also includes their diagnosis. So what happens is in the world of laws and regulations, if there is a connection, the way in which we can move forward is different than if there is not a connection. So that manifestation determination hearing is what gets us to that point. And that's what tells our, principals and our superintendents and our legal counsel how they are to move forward with a child with an IEP who's been suspended on multiple occasions.
You for breaking that down. There are so many of my listeners right now that would want to know. You've shared your experience. I've never been in a school, a district that has this kind of understanding. The work you do, bridging that gap, can create an environment where everybody has a shared understanding. Everybody knows their role. Everybody knows how to interact. And ultimately, will lead to student success because awareness is key. Can you share your work, how you can be reached if there's somebody interested here right now listening to us?
Yep. So I own and I'm the senior principal consultant of Scholastico Educational Consulting Firm. If a parent is interested in joining our community, checking out our website, we have lots of social media pages, Facebook, Instagram, LinkedIn, all that great stuff. But www.scholasticoconsulting.com. That brings you right to our website. And then just to kind of, give a little bit what we do, we do work with parents as far as individual or independent clients, and we focus on New York and New Jersey, but we do have the broadband to work nationally. We just have the conversations a lot in New York and New Jersey because often our regs are the same. Like in New York, we use Part 200 regulations. However, we also work in school districts, and we work with doctors' offices. We work with hospitals, medical settings across the nation, so that we are able to go in and set up frameworks, set up systems. We provide professional development on how practices can integrate neurodiversity strategies to improve the experience of their patients so that they can sustain patients. So it really builds those practices to make them, high quality facilities in regards to sensory and neurodiversity, especially our hospitals and our emergency departments, those kinds of places, as well as our pediatrician and our pediatric dental offices. So we do all of that great work. We also go into schools and we provide professional development in regards to neurodiversity, in regards to IEPs, writing IEPs, um, IEP goals and how that can meet the needs of both a child's diagnosis. So Scholastico does all of that work. And as I mentioned before, we're also a teammate of Croix, which is our holistic pediatric team. We also work with a medical facility, the Alexander Center in Fayetteville, New York. And that is also an integrated consortium medical practice that you do not need to be a patient in order to receive our services. So that's something that listeners might be interested in as well. We have this wonderful opportunity that I just love. We've been working with preschools for quite some time in an integrated preschool setting, but just recently we contracted with the Tree House in Watertown, New York, and we are able we're the administrators of that particular 4410. So we provide staff development, all of the goodness of IEPs, and we collaborate with medical practices to be able to get those preschool students the services that they need. So we have some really great things going on at Scholastico. And listeners can check out our website, our social media, and they can certainly get in touch with us, join our community.
Thank you so much. When you mentioned preschool, you could see the smile in my face because I always say that's the foundation.
Yeah.
That's where we catch them. And if we get it right, there's no stopping them. Thank you for the good work you do. So, Dr. St. Croix, thank you for sharing your experience and wisdom with us today on Unstitching ADHD Urban Ed Talks. For our listeners, this episode reminds us that collaboration isn't just a buzzword, it is the bridge between understanding and action. Please join us in this critical conversation by subscribing and sharing your comments. For more strategies, I will advise you also visit our website www.warebiassociates.com, where we have strategies and links to organizations that can support you. If you don't ask, most times you don't know. The unknown is challenging to everybody. But the more you know, the better informed you are, the right questions you will be asking at the right time. You won't be experimenting with your child. You will know exactly what to do. So thank you for joining us. And till next time, remember, the sun is behind the cloud. It will shine. It always does. Thank you very much.